Hello everyone, my name is Martha from Streamline Health Tech Company Limited, the EMR service provider. Welcome to a training video on how to use the pharmacy module in Streamline. And in this video, I will see how to receive prescription requests and also dispense them in the pharmacy. This session also assumes that you're already logged into your Streamline account. So the first step will be from the navigation menu, click on pharmacy and click on incoming prescriptions. Streamline will then display a list of prescription requests for the last 24 hours. However, you can go ahead and select any custom date of your own choice. So Streamline will display 4 different tabs or columns. One is paid but pending for patients who have paid for their prescriptions and are waiting for their medicine to be dispensed. Then we have unpaid and pending. This is for patients who haven't paid for their prescriptions and the prescription hasn't been dispensed. So we have paid and dispensed. This will have a list of patients who have paid for their prescription and also their medicine has been dispensed. Then this last column has unpaid but dispensed. And so this will hold requests for patients who have not yet paid for their prescriptions, but then their drugs have been dispensed. However, this can only happen and it's permission controlled. So it can only happen if your hospital administrator has permitted it or enabled it. Otherwise, Streamline will not allow you to dispense any medicine if the prescription is not paid for. So identify the patient whose prescription you want to process. I'll be using Mathanam. Click on dispense and then Streamline will then display patient information and then the patient's prescription so that the pharmacist can be able to see it and know what medication to dispense. So Streamline will also display the batch from which this medicine or these tablets is being picked from. So as the person who is dispensing this medication, please make it a point to ensure that you are physically picking from this very batch. So after that, you can use this in case the drug is, you do not have that drug, because the prescription is usually long you have many drugs. So for probably a drug that is going to be purchased elsewhere, you can check this box. And then if you want to alter the prescription, use this button. So to go ahead and dispense, click on this green confirm dispensing button. Then go ahead and complete the dispensation. So after that, Streamline will then generate a dispensation receipt that has the hospital details and the details of the patient, and it also has the drug instructions that the doctor wrote for the patient and any other drug instructions that the pharmacist could have written for this patient. So you can go ahead and click print to print this dispensation receipt and give a copy to the patient. So this is how we receive and dispense prescription requests in Streamline. Thank you.